नमस्कार। हेल्थ फॉर ऑल का आज का एपिसोड बहुत खास है, खास कई मायनों में। इसके लिए देश आजादी के 75 साल पूरे होने पर आजादी का अमृत महोत्सव मना रहा है। इसके लिए अलग अलग कार्यक्रम आयोजित किए जा रहे हैं। हील फाउंडेशन ने भी इसी कड़ी में एक अनोखा सम्मेलन का आयोजन किया, पद्मा डॉक्टर्स का सम्मेलन। देश भर के 50 से ज्यादा पद्मा डॉक्टर्स को एक मंच पर इकट्ठा कर उन्हें न सिर्फ सम्मानित किया बल्कि हेल्थ केयर सेक्टर में उनके योगदानों को याद किया। कार्यक्रम के चीफ गेस्ट और देश के हेल्थ मिनिस्टर डॉक्टर मनसुख भाई मंडाविया की उपस्थिति में पद्मा डॉक्टर्स ने न सिर्फ अलग अलग विषयों पर अपने विचार रखे बल्कि हमारा मार्गदर्शन भी किया कि आगे हमें क्या क्या और करना है। आज के एपिसोड में हमने उन पद्मा डॉक्टर्स में से कई को आमंत्रित किया है। ये डॉक्टर्स देश के नामी गिरामी विशेषज्ञ हैं, जिनसे आज हम उनके कार्यक्षेत्र पर और संबंधित बीमारियों पर खुलकर बातचीत करेंगे।
The 46th episode is very special as we will be hearing from Padma awardee doctors who have shaped India's progress in healthcare. But for now, we start this session with Dr. Atreya Nihar Chandra, a certified nutritionist and naturopathy physician. Her forte is working with psychology, craving, and food.
Yoga is something which is taught in naturopathy regularly, and I have been working out for a couple of years. So it's been 15 years where we are trying to work with women and women health. So wall exercises, which I'm going to show today, is something which I use with people, especially women who have varicose veins, who have ligament issues, who have ankle pain, knee pain, uric acid, sciatica pain. To get started, one, you have to touch your back to the wall. As you touch your back, adjust your pelvic to the wall. Relax is fine. Make sure your back is completely attached to the wall. Now you can do this on your bed. You can do this on normal yoga mat and floor. All right. Make your legs straight. Now press your leg gently on the wall. Now this giving instruction, this is feet inside, this is feet outside. This is something which we will be doing a lot of time when we go ahead. Now press your knees to the wall and take your feet inwards. As you take your feet inwards, toes close, toes open, 2 toes close, toes open, 3 toes open, 4 toes open, 5 toes open, 6, 7, 8, 9, 10. We'll start with ankle in, ankle out, 2, ankle out, 3, ankle out, 4, ankle out, 5, ankle out, 6, ankle out, 7, 8, 9, 10. You will see that there is a circulation which happens in your leg when you do this.
क्या आप संतुष्ट हैं? क्या आपको लगता है कि बहुत सब कुछ हो चुका है डायबिटीज में, 75 साल में हमने सब कुछ कर लिया है, या आपको लगता है कि नहीं अभी बहुत कुछ करना है? और अगर ऐसा लगता है तो क्या करना बाकी रह गया?
एक टाइम था जब 2014 से 15-16 जब मैं काफी इस बारे में संतुष्टि की तरफ चल रहा था, संतुष्ट नहीं था, संतुष्टि की तरफ चल रहा था, क्योंकि उस समय नया डायबिटीज कंट्रोल प्रोग्राम लॉन्च हुआ था इंडिया में, नेशनल डायबिटीज कंट्रोल प्रोग्राम, और उसके तहत बहुत तेजी से काम चल रहा था। हम सब लोग कर रहे थे, मैं भी इन्वॉल्व था इनिशियल उसके जो शुरुआत में रूपरेखा देने के लिए। तो उसके बाद 2 फेजेस में काम हुआ और 400 डिस्ट्रिक्ट में उसका कवरेज आया, लेकिन कुछ कारणवश उसमें तेजी खत्म हो गई। और ये चीज़ मुझको हमेशा लगती है कि हम हर चीज़ में एक मुकाम पर पहुंच रहे हैं। एक पोलियो को देखे या कोविड को देखे, सब में मुकाम पर पहुंच गए हैं। लेकिन डायबिटीज़ में कहीं इस समय मुकाम पर नहीं पहुंचे हैं। और इसी दौरान आपके फंक्शन में नहीं, किसी और फंक्शन में हेल्थ मिनिस्टर साहब से मैंने यही सवाल पूछा था। मैंने कहा था कि देखिए जो भी हमने करा बहुत अच्छा करा, लेकिन हाथ में पकड़ में नहीं आई डायबिटीज, और चलती चली जा रही है। और इसके लिए हमको एक कन्वेंशनल तौर से नहीं देखना है, नहीं सोचना है, हमको आउट ऑफ द बॉक्स हमको सोचना है। और इस बारे में मैंने डॉक्टर पॉल से भी बात करी इधर रिसेंटली, और मैं एक कोशिश कर रहा हूँ कि एक और नए तरीके से इस पर विचार हो। तो आप मेरी बातों से समझ गए होंगे कि मैं संतुष्ट तो नहीं हूँ और आगे के लिए चिंतित भी हूँ। हम रोज जो देख रहे हैं ये कोई आसान बात नहीं है उसको टैकल करना, कि हम जो लोग को डायबिटीज जिस उम्र में हो रही थी वो तो हो ही रही है, और सब यंग उम्र के लोग हमारे क्लिनिक में चारों तरफ फैले हुए हैं, और उनको कोई जीवन शैली में कोई भी रुचि नहीं है ठीक करने की, और तेजी से उनकी डायबिटीज बढ़ती जा रही है। तो इसको संभालने के लिए हमको नए सोच करनी होगी, हमारी सोच एक नए तरीके से आनी।
What exactly is ultrasonic picoemulsification?
Actually, there's a slight misnomer in it. Ultrasonic, you all understand, is ultrasound. It's the use of sound frequency to detect, like you get an image, etc. So what we are doing, phaco stands for lens. That means the lens, the natural lens which is in the eye. Emulsification, we all know it's to make something small. You grind it into small pieces or you emulsify it. So what you are doing is that you are using a hollow titanium needle. So there is a hollow titanium needle which is oscillating back and forth, and also it is oscillating sidewards at the speed of sound. Okay, that means that the number of vibrations or the frequency at which it is moving is at the speed of sound. So therefore it is called as ultrasonic. So it is ultrasonic phacoemulsification, and it is this movement which breaks the cataract into small little pieces. So for a layman, phacoemulsification would mean that you are doing a no-stitch small incision. That means that the incision has been shrunk to about 2.2 millimeters, through which this needle goes within the eye, and it breaks the cataract or the lens into small pieces and simultaneously sucks it out. So you are therefore able to remove the cloudy lens. That means that the lens which has become opaque because of aging, because of say trauma, because of even metabolic reasons like diabetes, etc., that needs to be replaced. So you have to take out that lens and replace it by an artificial lens. So that is the modern day cataract surgery.
Welcome to session 3. There is hardly any focus on preventive cardiology. It's all on curative. Why is this so? What are the benefits of preventive cardiology?
You know, ICMR in India, in 2013 conducted a very large study in younger people and people about 20 years of age. And it found that 45% of people were physically inactive. And now we have discovered that even people who are going to gyms, gymnasia, their focus is not on cardiovascular health or cardio exercises simply, but their focus is mainly towards the bodybuilding. So the very aim of cardiac health is jeopardized. I often explain to my patients that heart is such a peculiar organ in the body which starts beating when we are in the womb of the mother, and till the last breath of the life it keeps beating. It doesn't go on vacation, it doesn't go on leave, and it keeps beating even when we are asleep. All other organs activity gets different. So we have to really focus our attention to the cardiovascular health. And when we say cardiovascular health, we also include the rhythm disorders for which Dr. Balbir Singh is pioneer. We also focus on hypertension, that is the vascular disease. And we also focus on vascular related diseases, majority of which is strokes. And that strokes, as we were hearing, that disability at a very productive years is the biggest contributors to disability in the productive years due to the cardiovascular disease. Apart from that, sir, despite different programs, despite preventive educations, We have hypertension incidence, 48.4% responsible. Diabetes, we were talking, is responsible for majority of the cardiovascular diseases. Our obesity, which is associated with diabetes, psychological stress. These days, I'm finding 7 out of 10 patients are under stress. Poor fruit and vegetable consumption, alcohol, smoking, all these factors, dyslipidemia, typical to Indians with high triglycerides and high lipoprotein A levels. These all, summarizing your answer, is there are more causes than the steps taken for the prevention. So we are lagging behind in cardiovascular disease prevention. So this is a syndrome complex which has many components. So we have to decipher them holistically rather individually.
Is unexplained and sudden fainting due to arrhythmias?
So if we talk of fainting due to arrhythmia, we call this as syncope. So syncope, by definition, is a transient loss of consciousness, where a patient or anybody, I won't say just a patient, any human being, maybe sitting, maybe standing, just feels as if things have turned around and there's a blackout, and then just falls or slumps. And this slump is because of loss of muscular tone. So the muscle tone is not able to make the person stand. He falls down, and the passerbys or relatives are able to understand that something has happened, come to his rescue. Sometimes this rescue works, sometimes it doesn't work. So the person doesn't know what happened. When you ask him, they just say that something happened and they just couldn't see anything, and then they were down on the ground. So that is syncope. So syncope can be a simple syncope, which happens in young children. It could be a very dangerous arrhythmia because it may tell you that this person is very high risk for sudden death and you must treat him. Because if anybody doesn't come out of that syncope, that is sudden death. So this syncope business is very, very important. All patients who have syncope, irrespective of the age, should be investigated and treated, because treatment is possible and they can be given very good beneficial treatment. But understanding that some dangerous arrhythmias can cause syncope, which can lead to a death of a person, is one of the most important causes of sudden death. And as we have been just talking, that sudden death in India or worldwide is the commonest cause how the cardiac patients die. So we've all heard stories that the patient went home, had dinner, was chatting with the family, and never woke up in the morning. These stories are all sudden death related to arrhythmia and some malignant arrhythmias which cause death. So this is what syncope or transient loss of consciousness actually mean.
Session 4 is on acupuncture, the evergreen panacea for healing.
मोदी जी का जो होलिस्टिक मेडिसिन का जो सपना है वो कैसे पूरा होगा? आप एक राष्ट्रभक्त डॉक्टर हैं और आप इस पे बेहतर प्रकाश डाल सकते।
There is only one system of medicine that addresses the question of pain and suffering, whether it's allopathy, naturopathy, Ayurveda, Siddha, Unani, उससे patient से कुछ लेना देना नहीं है. He has pain and suffering and he wants to get relief of pain and suffering. So Narendra Modi ji has caused a kranti in establishing Ayush department. और इसमें से मैं आपको बता रहा हूँ, योग के लिए आपको पता है कि 21 June is International Yoga Din. For the first time in United General Assembly, 178 countries supported International Yoga Din. पूरी तरह से किया. This is history again. So Narendra Modi is not only working out various public health schemes, but he's also trying to support the historic, well-practiced systems of medicine. There are two questions I want to put before you. First is, I've written an article that the Indian doctors don't have time to listen. The second thing is, all pathies are necessary and relevant in system of disease. But what you lack is sympathy, empathy, passion and compassion. इसमें कमी है. तो नरेंद्र मोदी जी के for the first time there are non-health determinants of health. Swachh Bharat Mission. For the first time we launched it. Sanitation and water supply. In Western countries, United Kingdom and USA, they addressed this problem of Swachh Bharat Mission 200 years back. So Modi ji started that. That's very important intervention, public health intervention. He started National Nutrition Mission, and which Kishore, I want to say with all humility, I'm a member of that National Nutrition Mission. So water supply and sanitation mission, these are non-health determinants of health. Ayushman Bharat, again the third intervention. I've written an article, Narendra Modi as a public health person was introduced in India in the last, since 2014, is a public health champion. उसकी कॉपी मैं आपको दे दूंगा. नरेंद्र मोदी as a public health champion. तो उन्होंने देश में स्वास्थ्य न्यूट्रिशन में एक क्रांति लाई.
What exactly is the science behind acupuncture?
Sir, the science behind acupuncture is that acupuncture word comes from, it's a Greek word, acus and puncture, whereas acus means a needle and puncture means to penetrate. So basically the science involves penetration of a needle at specific points. So in our body, there are over 800 acupuncture points which are now identified. These acupuncture points are located along specific channels which are known as meridians. Say for example, there is a lung meridian. So there are points on the lung meridian. Now that lung meridian acupuncture point can be used not only to treat a lung disease, but can also be used to treat any disorder along that channel pathway. Say for example, a patient has got pain along the pathway of the lung channel. So you can use acupuncture points on that. The science is very clear. There are different theories now which have been confirmed by scientific studies that there is a hormonal activity which can be modulated with acupuncture through the brain. Again, everything is central nervous system regulated. Then we also know that there are natural pain-killing substances known as serotonins and endorphins, which are always present in our brain. So what acupuncture does is it stimulates the release of these endorphins from the brain to the area of pain. So pain modulation is done like that. Then it has also got a muscle building effect. So for that, there are specific acupuncture points which send the signal to the brain to create an increased blood supply to that particular area to build the muscle mass.